Good morning, everyone. It is 10 o'clock, so we are going to get started. Thank you so much for coming to the webinar. It is September 24th, 2022, and we're going to talk about lower back tips, prevention and treatment options from a physician. So I'm your host, Dr. Khanna. The webinar is hosted by Concierge Spine and Sports Medicine, which is my practice. So like I said, I'm Dr. Khanna. I'm board certified in physical medicine rehabilitation as well as sports medicine. And I have treated lower back pain for over 10 years. So I know all of it. I've seen the acute lower back pain, I've seen the chronic lower back pain, and I've seen everything in between. So I am here to help you as much as possible. So are you just sick of the lower back pain? Have you tried treating it yourself? Have you been putting off getting it checked? Have you had treatments, but then you just find that the pain keeps coming back? Are you frustrated that you just don't know when your back's going to give out? These are all very common things I see and questions that my patients ask. So my mission is to get you better and then give you tools to empower yourself to stay better. So the causes of lower back pain, we'll just discuss this briefly. 4 out of 5 people experience lower back pain. I think that number is actually 5 out of 5. I think at some point we all are human, we all are upright. I feel like we all have back pain at some point in our lives. Major causes are inactivity. And the biggest thing with COVID is that we've all been working from home. We have a desk job. Maybe we gained some weight over COVID, so we're carrying extra weight, and that puts stress on our joints. Age is a risk factor, smoking, stress, and then, I know you want to move heavy furniture, you want to help out a friend, but the opposite of inactivity is also a cause is overuse, where you lift something too heavy and then your back goes out and you're spasming for weeks and you're very frustrated with that. So I touched upon age. So we actually shrink as we age, and this is true. I know it may have been a myth, but it is actually true. These boxes right here are our bones, and in between we have discs, and the discs are full of fluid. And as we age, they become flat, like down here, where they're more flattened and darker. And then the discs actually herniate out a little bit like that as they flatten. Herniated discs don't always mean pain, but it can be a cause of pain. But if you have a herniated disc, does not mean you're going to have pain. So if you can imagine, all these discs, are going to flatten. And so we shrink as we age. And also the bones do become brittle. Women especially are at high risk for osteoporosis, where it means the bones are just not as strong as they once were. So that can cause compression fractures, which can then cause you to lose height. So how do we prevent the back pain? I highly, highly recommend we stretch. As we get older, we get stiffer. So we have to stretch. So one of the most things I would recommend you do, and I've started doing this every day, is 10 cat and cows in the morning and 10 cat and cows in the afternoon. Your back will thank you. So if you get anything out of this presentation, this is what I want you to do, is to get down on all fours, arch your back up, do a little meow, and then look up and do a moo. So cat and cow every morning, every evening. The next exercise I recommend you do is what's called a supine twist. You bring your knees to your chest and let the legs fall to one side, and then you let it fall to the other side. So you go side to side. This opens up the hips, which in turn puts less stress on your back. Another pose I recommend is a Sphinx pose. If this is too painful for you to do, please do not do that without professional help. You can just lie on your stomach. It's kind of like tummy time when you're a little kid. It's to bring that back, lie on your stomach, and then slowly you can work up to this pose. Core exercises are absolutely important. So this is another exercise that you can do. Just sit against a wall and activate your core. And you can just maybe work up to 30 seconds. You might only be able to do 5 seconds at once. And then you work up to 10 seconds, 20 seconds, 30 seconds, a minute, and you'll find that your core will get stronger. So the core is also very important in preventing lower back pain. So another things I want you to do to prevent lower back pain is drink water. So important. We kind of forget the basics. We need to stay hydrated.
Hello.
So caffeine and alcohol will make you dehydrated. So we want to make you hydrated. So if you are going to drink caffeine, I love my cup of coffee in the morning. You just need to make sure you drink an extra glass of water with it. And then the same with the alcohol. You know, we all like to have a drink on the weekends. That's fine, but you have to, for every drink you do drink, you have to have a glass of water with it. And then weight. Everyone has a different weight. I'm not here to, say that you have to be a specific weight, but I just want you to be aware of that. So I challenge you to just eat 2 fruits a day. That should be the easy challenge. I sometimes have to remind myself, we all get busy. I want to challenge you to try to put 2 fruits in your diet a day. And then you can go from there and then do 2 vegetables in your diet a day. I know all these physicians make these, oh, you should have 5 fruits and vegetables every day. And it's just so hard to do. So I challenge you just 2 fruits a day. And then that should hopefully encourage you to stop any extra sugar. So you're getting the sugar from the fruits. And now I want you to stop putting sugar in your coffee, in your teas. Don't drink any sodas. If you like that soda type of carbonation, switch to sparkling water instead. And then a food journal. If you actually write down what you're eating, you will see where you can actually make changes, because it all starts with you first. So I recommend you make a food journal, do that for 2 days, really. That's all you need to do to kind of just see your habits. I mean, ideally it's a week, but again, I'm just trying to give you the very quick tips of how to change, and write down what you're eating for the 2 days and see where you can actually make changes. And then of course, we're here to help you as well. So let's get into treatment options. I did go over a lot of preventions. So treatment options, you always want to start conservative. You do not want to jump into anything aggressive. You can, if you start having some discomfort, you can try some stretches on your own. You can go to yoga. You can put some ice on it. You can put heat on it. Now, there's always this controversy, which one's better? There is no right or wrong answer. If you like the heat, it helps you stretch, put the heat on. If it's really acute, I usually recommend the ice, like very severe, sharp pain, put ice on it. You can alternate. So a lot of times I tell my patients, heat, stretch it, then ice it. Movement. Now, it's quite important that you keep moving when you're in pain. People are they are tempted to just lie in bed all day. It's actually not recommended to be in bed while you're having back pain. You need to move. You need to get up and move. It's no longer recommended to sit in bed. Go to a physical therapist. You could go see a chiropractor. Sometimes you need a script for these things. So that's where you would want to see a physician. And that's what I'm going to go over. So when to see the physician: when the conservative treatments are not working, you tried over-the-counter medications, it didn't help. Your pain is consistent and it's not responding to the medications that you're on. If you start noticing weakness down your leg, like you can't lift your leg up or one or both, or like your foot starts slapping as you're walking, that's a sign that you need to come in and see the doctor. There is something called Cauda-Equina syndrome I just wanted to touch on. That's when you have completely loss of bowel and bladder. This is very, very rare, but this happens if you have severe low back pain and then you look down and you just urinated on yourself. That is a medical emergency. You do need to get to the emergency room if that ever happens. Again, it is extremely rare. It is a surgical emergency, but hopefully nobody ever has to go through that. So then I'm going to touch upon how to treat your lower back. Say you've tried all the preventions, you've tried all the conservative treatments, and you've never looked at what type of injections are out there. So I'll go over a few of the injections that are options. They're always optional, 100% optional, but they can help. So trigger point injections, these could be for those annoying knots. You can get them pretty much in any muscle of your body. These muscle knots that just won't go away. You're just irritated with them. What I do is I inject a numbing agent so that you don't feel anything. And then I use the needle to break up the spasm. You may feel a weird twitching during the response because it is a muscle after all. But you're numb, so you don't really get, it's not too bad of a procedure. It is a little uncomfortable, but then afterwards you do feel sore, like you had a deep tissue massage. So what I'm doing is I'm creating a deep tissue massage on the inside with a needle, and it helps release the muscle knots. Epidurals are obviously very famous to treat lower back pain. Everyone has heard of epidurals. Not all injections are epidurals. That's another myth out there. There are various different other injections, which I'll get into. But the epidurals is really for those that are having lower back pain that go into the leg. So if you're having lower back pain, it's radiating down into your leg. That's when to get an epidural. It is a steroid. Sometimes people said, oh, I had an epidural, but I've never had a steroid injection. Epidurals are almost always steroid. So steroid is there to calm the inflammation down. So another treatment option. So this is for lower back pain that I wanted to bring your attention to. This is what's called a facet joint medial branch block. So this is when you're having pain across your back. It's not getting better with anything. This is a great option. This is where we target the nerve that goes to the joint, and that nerve is called the medial branch nerve. And we numb it up with lidocaine, which is a numbing agent, to see if you get better. And then we repeat it again. And then we numb it up with a longer acting numbing agent called Marcaine or bupivacaine or Narcaine. There's a lot of different agents out there. And we try to see if you get relief again. And then the third time, what we do is we put a wire inside the needle and burn off that medial branch nerve, so you no longer have pain. And this sounds scary. A lot of patients get a little concerned about it, but it's like getting a root canal. When you get a root canal, you're burning the nerve to the tooth, so you don't have pain in your tooth. So this is the same concept. You're burning the nerve to the lower back medial branch nerves, so you no longer have pain there. You do have other structures, so if something were to go wrong, you would still feel it. But this is great for pain across the lower back, for your joint pain. It is extremely safe because the nerves do grow back. So if it doesn't work for you, and there's really very little harm, we just know it doesn't work, and we'll go on to something else. And because the nerves do grow back, you do have to get this repeated every 1 to 2 years. I've seen it work up to 3 years. It just all depends on you. So when you're getting it burned, it's kind of like the root canal. You don't actually feel it getting burned. It's numb. So it's just an injection going in, and you don't feel any heat or anything, or you don't smell anything, because I was asked that question. I was gets asked. All right. And then the last injection I wanted to touch upon is called the sacroiliac joint injection. So this is the lowest joint in your back. It connects your hip to your pelvis. So sacrum to ilium, called the sacroiliac joint. So when people have the pain here, it's a lot of times secondary to all the pain up higher. Or you can have just localized sacroiliac joint pain. And I see that a lot in women who just gave birth or are pregnant. So the SI joint, sacroiliac joint, generally gives you back pain radiating into the groin or hip. So we can put medicine right to the joint, which can calm it down. And then you've got to do your exercises to keep it away. So like I mentioned, the injections are there to help calm the inflammation down, but you still need to move. You've got to go to therapy, work with an athletic trainer, go to yoga, whatever it is. You've got to keep moving to keep the inflammation away. So then when you are feeling better, I want you to maintain that. I don't want the pain to just keep coming back. So ways to do that is mindset. So we are building a Zen room at this time, which is under development. And we're going to have these high-end massage chairs there where you can just zone out. So that'll be kind of the meditation room. Coaching, wellness coaching. We all need a wellness coach. I need a wellness coach, and I'm a physician. Someone should just go over how to eat right and stretch right and just take care of yourself right. We all need to move. So that's where the PT exercises and yoga exercises are important. And then the basic nutrition, which can be done by the wellness coach. So in summary, I went over things for prevention. So like I said, if there's one thing you get out of my talk today, it is that I want you to do cat and cows every morning and every evening. Get on all fours and do your cat and cows. I want you to hydrate, drink your water, more water and more water. I also challenge you to eat 2 fruits a day. We discussed some injection options, and then we discussed how to keep the pain away. So the mindset is so important, movement, and then optimizing your nutrition. And that is where I think we need the most help in healthcare, is the how to keep the pain away. So I've teamed up with a health coach at the Navy Yard. This is Robbie. He's part of the TB12 method, which is Tom Brady's company, but we are teaming up together, and we are helping you optimize your nutrition. We're helping you go over your stretches to maintain, and just your diet, doing food journals. So we decided that we will, after you see me and get better, you can go upstairs and talk to him, and he will give you his first appointment for free, so that we can help you get the most value out of both of our treatments. And I hope you really take advantage of this, because he's an awesome guy. And I think, once I'm done treating you, staying on with him is going to be a great way to keep your back pain away. And then the value you'll get is that you hopefully will empower yourself to stay pain-free. So this is me. If any of this stuff resonated with you, I have tons of more information on social media. You can check out the YouTube channel, subscribe to it. I'm constantly putting more information out there completely for free. I'm also on Instagram, on TikTok, on LinkedIn. If you're not already liked on our Facebook page, go to our Facebook page and like Concierge Spine and Sports. I put out a lot of information out there because I really want you to stay healthy. So once again, my mission is to get you better, and then I want to give you the tools to empower yourself to stay better. So if you do need help with anything low back related, I am in the Navy Yard. That's the address. It is a nice, cool part of Philadelphia. You don't have to worry about parking or anything. It's a kind of a suburban type urban area. We do the injections on site. We have the yoga instructor on site. We do have Robbie, our health coach, on site. So that's the website, cssmpa.com. A lot more information is on our website you can read through, discussing more in depth about epidurals if you're interested in that. If you have any questions, you can email me. That is the email I check daily, which is support@cssmpa.com. You can call the office if you have any questions, or if you're interested in making an appointment to come see me. So at this time, I will take any questions. So if you have any questions, please put it in the chat and I will address them. So I do see a question here. Do you have to be asleep for the injections? No, actually, you are not asleep for the injections. You're numbed up. You most of the time you're lying on your stomach, so you don't see it happening, and you're completely numb. Very few of the patients I will take them to the surgery center and put them to sleep if they're really anxious about it, but actually it's not recommended to be asleep. It's safer to do it awake. So another question I have is, do the injections hurt? Afterwards, you can be sore where the injections went in, but as I'm numbing you up, it will be a little, it burns for a couple seconds. If you've ever gotten like your mouth numbed up for cavity filling, it burns for a few seconds and then you're numb and then you feel pressure. So you don't always feel a lot of it. And then if you do, I do add extra numbing medicine. And then I do have another question. Do you take Medicare? Yes, we do accept Medicare. And then another question is, how long do they take to work? Oh, very good question. So the injections, when you do get a steroid injection, it does activate in about 2 days, and it can take up to 14 days. Sometimes you need one injection, sometimes you need the series of injections, and sometimes it just may not be effective, and then we start talking about even more aggressive treatments like surgery. But my whole point is I want to try to keep you away from a surgeon. And here's another question. Does choice in pillows and mattresses help with prevention or treatment? Unfortunately, there is no magic mattress or pillow out there. If you are uncomfortable or having pain, I usually recommend you lie on your side with the pillow in between your legs. Also, just a general recommendation I have is that you are on a firm mattress. You don't want to have a squishy mattress, and then you do need to change your mattresses every 10 years so that it doesn't have like a divot inside. But fur mattresses generally what's recommended, but there's no magic mattress or pillow out there. Maybe one day. And then another questions. Do you accept other type of insurance? Yes, we are going to network with some insurances. So call the office and we will help you navigate what insurances we accept at this time. All right. So I think we got through all the questions. If there are any other questions, please put it in the chat. Well, I hope you enjoyed the presentation today. I'm really happy that you joined me on a Saturday morning, and I hope to be able to help you in the future in any shape I can, whether you want to watch some of my social media videos, or if you want to come in and meet me in person, I would love to meet you and help you one-to-one. All right. Thank you so much. It was so nice seeing everybody. And thank you for coming out on a Saturday. And for those of you that missed it, I will be posting the replay. Thank you.
Cool. Baby, you up?